Thank you all for joining us today. This is our combined affinity group call. Today's Thursday, October 19th, 2023. Today's meeting will obviously be run a little bit differently. We figured because we had the patient summit earlier in the month, we didn't want to bombard you all with the 6 different group meetings that we have. So today we have everyone from all of our 6 different affinity groups as well as our legacy group together. And we have a special presentation from TSA. So we will have our pre-work discussion, a few general announcements, and then we'll jump right into that. As always, we do like to welcome our folks from CMS, Centers for Medicare and Medicaid. We do have a new representative joining us. His name is Jim Todd. He is not on today. If I see him joining later, I'll have him introduce himself, but he will be our new CMS representative moving forward. As always, we have your NCC team. I am Emma, and Stephanie Hull, who you all are very familiar with, is typically with us, but she is off today. You'll be seeing her in future meetings. Meeting logistics as usual. So when you join the call, your line is live. So please feel free to mute your line. If you're having any issues, please let us know, and we're happy to help you with that. We do want to hear from you, so please utilize that chat feature. I see some of you are already utilizing that. It's a great place to ask questions, share your thoughts. We will have lots of opportunity today for you to come off of mute. If, again, you have any issues with that, please let us know. We will have an event survey after the meeting that we will send out via email and in Basecamp. And as always, this call is being recorded, and we will post the recording in every single one of our Basecamp groups, as well as send it out in a post-call email. So we are gonna just kind of get a feel for the room. Love to know who you are, where you're coming from, but also which affinity group you are joining us from. So please feel free to use the chat. It's the little chat bubble that's in your right hand corner. Pull that up and you should be able to see some of the chatter. Sherry, welcome to the call. No worries. Coming from Connecticut. Jim Brooks from Wisconsin. Michael's from Oakland. He's from our transplant group. Walt's from Washington. Welcome to everybody. Delota's from Maryland. Kim from Rhode Island, another transplant. Got New York, Jamie. Chelsea's from Sacramento, California. Ken from Texas. Sophia Schaefer's. Oh, it's moving fast. Sorry, I'm losing you all. I'm gonna let you all put some in there. We've got some vaccine affinity groups. We've got a few that are in multiple groups. A few who are part of our legacy. Vaccination Health Equity, wonderful. Transplant group. Looks like we have a good representation across the country. Arizona, Washington. Let's see, who else did I mess up here? Alabama, Richmond, Texas, Legacy Group, Depression Group. Perfect. Appreciate you all using that chat, letting us know where you're coming from. We always love getting you all together. It's great for you all to connect. So please feel free to use the chat to also reach out to each other, get to know each other, especially if you've never met in the different affinity groups. Perfect. So our objectives today, our agenda, we're going to review some of the pre-work. Thank you to all who had the opportunity to complete those questions. We have our speaker, Marie, today, who's going to take up most of our time and share some of her wonderful knowledge. As always, we'll review Basecamp and then look at those next steps and updates that you all can expect. So our pre-work questions, as many of you saw, were around travel. And this was all sorts of travel. This could have been by air, by car, by bus, by train, whatever that might look like for you. And that's going to be the big focus of our call today. Our pre-work question, our first one was, what difficulties have you encountered while traveling as a dialysis and/or transplant recipient? And I love the responses that we received because they definitely covered the gamut of the different types of travel, but also, difficulties look different for different people. So I see Cynthia, oh, I'm sorry, Sherry in the chat here put having a walker is one of her difficulties for travel. It's a really good point. Some of the other responses that we received back was just the impact on treatment. So sometimes it's difficult to get a chair time that works with your travel. You have to have extra support, whether it be to pick you up, drop you off, or to drive you there. Just the overall exhaustion of having to have treatment while you're on vacation or on a trip can be really challenging. A few people added who were traveling by air, just the requirement or the feeling that they need to have a carry-on bag to ensure their medications make it. A few had examples of when they didn't do that and their bags were delayed and they were in a pickle basically of not having their medication. So feeling like they always had to have a carry-on bag. Some didn't have their equipment managed correctly. This was referring to folks who were traveling with their home dialysis equipment. They were told that it would be with them in the cabin and it was put below, or they could tell that it was being mismanaged. So that was a challenge for them trying to work with the TSA folks to ensure it was being managed properly. Issues with other passengers, just passengers not understanding why folks were getting priority boarding or special treatment, whatever that might look like. So just kind of managing those circumstances. Cleanliness was a very popular one. Some of the examples given were if they were getting patted down by TSA, touching them, not changing their gloves, not washing their hands, having to maybe do PD in the airport if they had a long layover, a long flight was an issue. One that came up, and this one was new for me, was issues with the hotel accepting deliveries. Some hotels apparently have a fee if you are delivering things to their hotel, depending on the size of the box or the amount of boxes, they would charge you. So that's something to keep in mind. And then we had a lot of responses of people not having any difficulties. And I was really happy to see that people have traveled via train or car or air, and it went very smoothly. So that was really nice to see. I'm going to hop over here to the chat. So Jay put in taking enough dialysate to get to his destination, and also that sometimes he has to travel by car instead of plane. And that can be hard to get a chair. And that hospitals need training in home dialysis. Yeah, I would say majority of the responses that we received, the biggest struggle was for those folks that were doing in-center trainings, in-center dialysis, getting a good chair time or finding a facility within a reasonable distance, because that can be really challenging. Great, please keep putting in the chat here if you have anything to add. I'm going to move on to the next pre-work question. And this was to, flip it over. What advice would you share with someone who is traveling for the first time as a dialysis or newly transplanted patient? So 90% of the responses were about being prepared and to utilize your dialysis center staff, whether you're in center or home, planning as far out at advance as you can, whatever that might look like, whether it be setting up a treatment if you can. I know sometimes that can be difficult with timing. Some receiving facilities will only let you plan up to a couple weeks in advance, so that can be challenging. Prepare how you're going to pack, if there's things you need to send in advance, just lots of preparation. Another common was ensure you have enough medications. So on you, with you, and also research pharmacies for emergencies and have that conversation with your provider in advance of how you'll be able to get a prescription if needed last minute. A few people recommended taking paper documents of all your treatment and medications, really having that with you. Some people take paper, some people have it on like an app, but just having that on your body just in case you need it. Sometimes when we get into stressful situations, even though We may know your treatment and medications front and back. When you're in that stressful situation, it can be hard to remember, so having that written down can be very helpful. Again, another one was taking those medications on board, not checking them. One that came through, which I thought was something that we often don't think about, is pre-planning meals or restaurants. So doing a little research about where you're going, where might be dialysis or transplant diet friendly. Consider if your hotel has, a breakfast, is it going to be able to serve your needs, that sort of thing. And then, as always, have a backup plan for delays or cancellations. So having a plan B or C, whatever that might look like for your situation. Here in the chat, Delonta says, don't be stressed. I love that. Sherry put, take your original med bottles and don't take a pre-poured tray. That can be very helpful to have just that specifics on there. Speak to your destination dialysis center to make sure they have all your records needed and are where you're coming on the day you are there to be there. I like that, Anthony. I think depending on when you're traveling and how confident you are, it can be helpful for you to actually directly connect with the receiving dialysis center versus just having your dialysis center speak with them, just so you have all your questions answered. And Sherry is adding in there, if you use the ESRD emergency app, you can carry your information with you. Great. Wonderful. Thank you all so much again for anyone who added to the chat or anyone who was able to complete the pre-work. We all, again, are kind of coming from different situations, so have different suggestions on how to best prepare. So these were some really great examples and suggestions. So I am going to stop talking for most of today and hand it over to our presenter, Marie Trottier. She is our Outreach and Engagement Program Manager at TSA. As you can see here, she has some very extensive and impressive credentials, and she comes to us with a lot of experience. So I'm going to hand it over to you, Marie. I'll go to the next slide here, and you just let me know when you want me to advance. Thank you so much for joining us. And you are on mute, Marie. Mute, Marie, I apologize. Let me see. Oh, well. Okay, let's see. No, I can see your mouth moving and you were working earlier. Did you want to try to log out and log back in? Okay. Perfect. And while she's doing that, if anyone has any specific questions that you may want to pose to her, just with your experience with using TSA, if you have an upcoming trip. I know some of you sent some questions in advance, so we shared those with Marie, so thank you for doing that. But as we're going through the call, please feel free to use the chat, and she'll do her best to answer those. We'll make these slides available as well, of course, the recording, and then she'll share her information afterwards, so you all are able to reach out to her if there's specific questions that come up.
This is Tracy Robinson. I'm on the line. I'm on the phone.
Tracy, thanks for joining us. We can hear you loud and clear. And I see, Jay, you just found out about the ESRD app. Looks like you're downloading it now. Marie, I see you're back on. Can we hear you now?
Can you hear me now?
We can. Perfect. Thank you so much.
Technology is great until it isn't. Right. Absolutely. Right. So thank you for the invite. Thank you for the warm welcome. Appreciate being here. And I think that I loved the pre-work questions and answers a lot, because everything is individualized. It's that situation of what works for one person doesn't work for others, and just to be mindful of that. And again, some of the experiences that you've all had, whether it's flying or cars or hotels and whatever, everyone has, and those are obstacles, because it certainly is, it's more time intensive as well as your personal health intensive to plan for travel, whatever that may be. And I find it interesting because I've not had this experience of hotels not accepting deliveries because, again, my husband since passed away, but had Becker's muscular dystrophy and on a ventilator 24 hours a day, had to have a lot of medical supplies, and we always shipped them to the hotel. I mean, we had them at home and packed them up and shipped them to a specific person and whatever. And even in terms of, like, I was presenting at a conference in July, and I ended up in Austin, Texas, and ended up sending a bunch of my things ahead of time because I knew that they just wouldn't fit in my suitcase and things. And I haven't encountered those problems. So, but again, with big corporations and lots of policies and procedures and rules, things do happen. But let's talk about TSA. So if we can advance the next slide, Emma. So TSA's overall mission is to protect the nation's transportation systems to ensure freedom of movement for people and commerce. It's primarily aviation, but it's also rail, cargo, and ports of entry as well. But in terms of the traveling public, in terms of all of us here today, it would be via air. Next slide, please. So we do operate security screening activities at more than 450 airports that are federalized across all 50 states, as well as Puerto Rico, U.S. Virgin Islands, Guam, Samoa, and the Northern Mariana Islands. We have approximately 60,000 TSA officers that are the front line throughout all of these airports. And just in the spring of this year, we were screening 2.3 million people a day, but we're up over 2.5 million travelers and their belongings every day. Clearly, we're screening for weapons, explosive, and other hazardous items. And unfortunately, our officers are encountering too many guns going to the checkpoint, as is in the news frequently. Now, all officers receive training with emphasis on treating passengers with dignity, respect, and sensitivity. And also, officers do receive training on diverse traveler populations, including individuals with disabilities and medical conditions. Next slide, please. So something that I do recommend if you do travel even once a year is TSA PreCheck, because it's expedited screening. It's shorter lines and wait times. You don't have to remove the 311 liquids, belts, light jackets, laptops. And also the officers may swab your hands, your mobility aid, your equipment, and other external medical devices to test for explosive. So that's what that swab test is. It's an ETD, it's an explosive trace detection. And then footwear may undergo additional screening, but not required to be removed. You can request to be seated at any time during the screening. And if you're not using a wheelchair, either your own or with one of the contractors through the airlines, then there should be chairs available at each of the checkpoints. And so again, go to tsa.gov if it's something that you're interested in and want to find out more about. Next slide, please. So on tsa.gov provides all the information, and we update it frequently in terms of, especially for travelers with disabilities and medical conditions. So TSA Cares is a toll-free helpline with the number listed here, 855-787-2227, and it provides information on screening procedures pertaining those with disabilities, medical conditions, and other circumstances. Here's a great place to call ahead of time if you want to make sure that extra medication or extra medical supplies are going to make it through the checkpoint. You want to be able to have that communication. I ask you to please call at least 72 hours in advance, but if you have specialized, unique questions like this, I would ask you to call, a week or more in advance if you can. You want to make sure that you're getting, email communication and or, phone communication back, not only from TSA Cares, but hopefully from the airport you're traveling through. So TSA Cares, this toll-free helpline, then coordinates the PSS, the Passenger Support Specialist. Now, Passenger Support Specialists are TSA officers with advanced training on helping individuals with disabilities and medical conditions predominantly. I mean, it was started 11 years ago specifically for travelers with disabilities and medical conditions to get them through the screening checkpoint. It's open to all travelers who may need assistance, but the foundation and the emphasis is on individuals with disabilities and medical conditions. And so again, you contact them at least 72 hours in advance so that again, the TSA Cares helpline can coordinate with your travel, with the airport you're traveling out of. And you can certainly follow up with them. You might receive a follow-up template or email in terms of that information. But I know how valuable they are to a lot of the organizations that I work with and a lot of these presentations that I do both in person and online. Next slide, please. So in terms of within the Civil Rights Office where I'm housed is the Disability and Multicultural Branch. And so we're the primary point of contact with TSA for reviewing, conducting inquiries and making final determinations regarding passengers' complaints that are civil rights complaints that are alleging discriminatory conduct within the screening procedures. And so again, we do conduct outreach and engagement, and that's my responsibility as the outreach and engagement program manager. We do create and provide training for the field and for the public, and we update that on a regular basis. We do review and support TSA policies and procedures. And we do a lot of intergovernmental, outreach specifically regarding protection of civil rights with Health and Human Services, Department of Justice, and many others. And also within our office, the national program manager for the passenger support specialist, as well as language access, are within our office. And yes, to Sherry, the passenger support specialists are accessed through the toll-free number. You contact TSA Cares to request a passenger support specialist and/or to ask any other questions that you may have in terms of TSA. And if we can go to the next slide, Emma.
And real quick, Marie, would you tell us a little bit about what the language access program is?
Sure, absolutely. I'd be more than happy to. And actually, we don't need to go to the next slide because the next slide is the end in my information. And I want to go to the Q&A and the advanced questions you gave me. So the language access program is like anything else, because of the size of TSA and the fact that we are literally screening and touching more members of the general public than any other agency in the United States, because of screening 2.5 million people a day. So the language access program is to work to provide translation options for officers to engage with travelers when English is not their primary language. So again, and also we're doing that with written material, signage in the airports, and a number of other things, so that in terms of Spanish speaking or whatever else, but there may be individuals going through. So we are typically able to translate. And the other thing that we do is, there are officers at the checkpoints who are fluent in other languages, and they are known to their colleagues and to their superiors to be able to be a resource when officers need someone, who is bilingual or multilingual to be able to, but we want to make sure. And a lot of it too is making sure that their advisements are understood. The advisements are when they say, please put your hand up over your head, please step on, the yellow footprints in the advanced imaging technology, the AIT machine, please step forward, or telling you that your bag's been, pulled, the bag alarmed, your carry-on bag, and it's been pulled, and you're going to meet with an officer, to talk about that, definitely. So those things are, incredibly, important, and it's something that, again, you can ask TSA Cares for in advance, or you can ask when you arrive at the checkpoint if you're traveling with multi-generations in your family, or you may have a caregiver or a companion who English, it might not be their first language, and you want to get somebody who is bilingual or multilingual to assist through the screening process. That's possible as well. Does that help in terms of language access? Okay.
Yes, absolutely.
And again,
Thank you.
yeah. There's a piece of legislation called the Translate Act that's specific to TSA that was just signed a few years ago, but basically in terms of enforcement now, and it enhances language access in many more places, definitely. Do we have a protocol for a passenger who has a language that you don't have someone to translate for them? Yes, we do have something called the language access binder, where again, there are simple advisements translated into multiple languages. And so the officer would get that binder, open it to the page with your language, and then be able to show you in your language, English for the officer in that situation to go through that. And the other thing too is because the airports are not a standalone, I mean, there are basically three separate entities at any airport. There's the airport authority that owns the real estate and the physical space. There's TSA at our checkpoints, and then there are all the airlines. So there are multiple, entities. And I'm not going to talk about like the restaurants and the vendors and things because they're usually just lessees and renters. But in that situation, it's incredibly important. So Sherry, you have balance issues, but I'm feeling like you have to try to stand up on the footprints in the machine to prove it. You travel in a wheelchair, but they always ask me. Okay, so if you're not comfortable standing, because again, it's really to keep that stance in the AIT machine, the machine with the yellow footprints, for typically like 7 to 9 seconds or 6 to 10, which again, if you've got balance issues or you've got any mobility issues, can seem like a very long time in that regard. Then again, you can just say that you can't do that comfortably, and they will screen you in the wheelchair. But again, please understand that screening you in the wheelchair will be more of a full body pat down. So, I mean, again, there are pluses and minuses to understand in terms of getting through the screening and the technology. But again, there are options that are open to you. And I would also say, please look at tsa.gov so you understand the options that are available. The other thing too is if you have PreCheck or PreCheck is an option for you, then you don't go into the machine with the yellow footprints. You go through the walk-through metal detector, which literally is you just walk through. You just walk through in that situation, again, if you are physically able to do it. It's similar to when, we're at an event or whatever, and they've gotten much more respectful about saying, everybody stand for the national anthem if you are able to stand. But for people who are not able to stand and be in a standing position, for 2 or 3 or 4 minutes, then it's understood that you don't have to stand. Anthony, the languages don't necessarily cover all the dialects. I mean, that's a phenomenal question in that regard. I mean, they're really the primary languages of those, countries in that situation. The only thing I will say is when it's our officers, if it's our officers who are bilingual or multilingual, some of the dialect pieces, may, come into play. And again, if you're, flying through an airport like Miami, where there are multiple, multilingual officers, there may be a Puerto Rican dialect and a Salvadoran dialect and a Dominican dialect and that kind of thing. But certainly that's going to happen more in the urban populations or the airport populations that are closer to those islands and countries and those dialects. But that's a phenomenal question. I've never had anyone ask me that question before, but it's great. Just because, right, language is not a standalone. Language is not just a mono situation of one language on its own. That's excellent. But I think, Sherry, if you're not comfortable standing, then you should just say that you can't hold the stance for that long a period of time. And again, you can call TSA Cares ahead of time, just for advice, not even if you're necessarily flying, but just to kind of get some information from them, as well. And certainly, Emma has my contact information so that if there's anything that I can help with beyond today, I'm happy to be a resource for all of you in that regard. So I want to answer some of the questions that did come in and some of the things that I hope my brain remembers from the pre-work situation. So I think also, how can dialysis patients make the traveling experience easier, and also staff at the airport when traveling with home dialysis machine and supplies? Again, I mean, every external or internal medical device is different. So I think, again, a situation of calling TSA Cares ahead of time, giving them the information, even if you don't want a passenger support specialist to help you through the process, but even if you want to make sure that the airport understands what your equipment is, whether or not it can be screened or how it can be screened, you certainly can do that by contacting TSA Cares ahead of time. Because again, we want to make it easier for you as well. We want to make it for all members of the traveling public, because we know that traveling with a disability or medical condition and traveling with medical equipment and supplies and medications certainly is more anxiety provoking and more nerve wracking and more stressful than it is for travelers who don't have these medical conditions and these challenges. So that's one of the best things that you can do. I think, also preparing, decrease the chances to prepare to be stopped with your medications. And I understand you don't want to check them for fear of being lost. And while I support that wholeheartedly, but I just want to say, please call TSA Cares ahead of time in that regard. And I would also say, because you want them to understand that you may have medications for a week and you really need to be able, or even a long weekend, and you don't want any questions about that, because again, there is some officer discretion about reasonable quantities in terms of medications. But again, it's not just the flight. Even if you're flying, East Coast to West Coast, it's not a 6 or 10 hour flight with stops or whatever. It's a situation of you need those medications and those supplies for the entirety of your trip, whether it's 3 days, 5 days, or a week. So again, while I completely understand not wanting to put things in checked baggage, in that regard, I think that either, getting a hotel and what I do is I call the hotel directly. I don't call the hotel chain like 800 number. I look up the phone number of the hotel in LA or Spokane or Chicago, and I call them directly and I talk to somebody directly and say, here's my reservation. I'm checking in on Monday, October 23rd, and I want to send you a box via UPS tomorrow. That is, that is, it's for me in that regard, because then I can send it UPS ground guaranteed. I know that it got there, and then I don't have some of the same, TSA hassle. And again, this is all individualized in that regard. And so, Anthony, all of the rules apply to all TSA airports. So all of the federalized airports in that regard, even in terms of, if it's a TSA airport, if TSA officers are there, either in terms of in uniform and or in terms of private service, but it's through TSA, then again, yes, then that applies. But in terms of the really tiny airports that don't have TSA security, I would check with the airport directly, because again, with the significant threats that are going on and the significant threat escalation since the start of the Israeli Hamas war, even small regional municipal airports may have privatized security. So even more so, you want to make sure that you know what your rights are there, and you know that something is not going to have to be surrendered, or that you're going to feel like it's been confiscated in any way, especially given what these supplies are, because we know that many many private security companies that are used to providing security for apartment buildings or college campuses or banks or things don't understand individuals with disabilities and medical conditions and the supplies that they need. So you want someone who has a level of understanding to respect and to actively listen to you. I mean, to actively listen so that you make sure that you are able to get your information in. Thank you, Vernika. I really appreciate that, definitely. But again, it's one of those things that again, nobody is just one of something. I'm a white woman, but I'm over 40 with a disability. So I fall into a number of protected classes in that regard. And race, and we know based on race and ethnicity and national origin, there are other medical conditions and diagnoses and disabilities that individuals may, have a predisposition for, genetically or otherwise. So because of the fact that, we are in multiple categories, then it really is important that we're protecting all travelers' civil rights. So,
Marie? I'm so
Go
sorry.
ahead. Sorry, Emma.
I just wanted to piggyback on you were talking about medications. One of the questions that came through the chat was if there's any sort of specific paperwork that folks should bring with their medications to help the process.
So I think that, okay, and what I do, like I have a lot of medications in that regard, is I literally print out my list of medications, from like my primary care physician's website portal, my patient portal. I print it out and I literally take that list with me. Because again, I don't get any special privileges going through TSA. I mean, in that situation, I'm just a traveler when I'm going through. So I have my list of medications, in that regard, just in case, so that when they, and I also, somebody suggested it earlier, and I forget who it was, but I agree with this and I support it. And this is what I do, is traveling with the original prescription bottles, in that regard, especially for prescription medication. But even in terms of the over-the-counter medications, what I've done over time is like through CVS and Walgreens and other, national drugstore chains, I've gone in and I've purchased the travel size bottles or the smallest quantity bottles, and then that's my travel bottle. But again, then it's the original of, Allegra and Zyrtec for my allergies and Advil, for ibuprofen and that kind of thing. So those things are, I think, incredibly important. But again, an officer and many officers are much more empathetic and understanding when you literally like open your carry-on bag, or like for me, I have a, basically like a cosmetics bag in my travel bag that's filled with all my medicine bottles and whatever. They open that up and there's like 12 or 15 or whatever the number is in there. It's much more daunting and overwhelming to understand what you're actually traveling with, in that regard. So again, and there's no one size fits all. There's no cookie cutter approach. I mean, and I will say that I've been at TSA for 9 years now, and I've become a much more savvy traveler being on the inside. The more that I know and the more I understand, and the more I'm involved with us buying technology and buying equipment. I just went and tested a new piece of technology in one of our secure facilities that's not even out at the airports yet, but I tested a new piece of equipment last Thursday. And I'm writing up, my information, definitely, to give the situation, because it's going to be something that we need to that is accessible to people with disabilities and medical conditions. And so we need to make sure that it's going to work for all travelers, and that, that full accessibility is always there, definitely. I think, again, a doctor's note is definitely helpful, especially something, from your doctor, to say that you're a kidney patient. I think that's a great thing as well, especially when you're traveling with, medical equipment or other supplies, or again, if it's a situation where you're going through treatments and maybe you're traveling the day before a treatment or the day after a treatment, and it's not your best day of the week. I think anything you can. Also on TSA.gov, there's something called the disability notification card. Again, it does not have any detailed information on it, but it's something that you can download and print off and hand to the officer. Again, for everybody here, and what Emma has educated me on before today, and what all of you are educating me on in terms of our session today, is there's so many things that you have to take into consideration. Then I really do strongly recommend that if you are doing air travel, certainly then to call TSA Cares. And I think, for an international portal, in that regard, yes, I mean, if you're talking about traveling internationally, then again, you can go to TSA.gov for any flights that are traveling internationally that originate from the United States, but also go to CBP.gov, Customs and Border Protection, CBP.gov, because CBP will be who you will deal with when you come back into the country. So all those medications and medical equipment and whatever. So even if you go to like the British Virgin Islands, even someplace that's not too far away, but is not part of the United States. I mean, for me in the East Coast, type of thing, it's just another, 3-hour, flight. Then I think in that situation, you may want to go to cbp.gov in that regard, just to be able to get that information. And I'm putting it in there as well. So
Thank you.
I love the idea of the doctor's note, and I love the idea in terms of Anthony. Yes, on the doctor's letterhead. Not. I mean, what I've said in presentations my whole career is not on a cocktail napkin. Not on a piece of paper that looked like you just wrote it. Type of thing, like the dog ate my homework kind of thing. So in a situation of yes, if it's on the doctor's letterhead, and I would say, if you could make a couple of color copies so that you've got a copy for yourself that you're taking and whatever in that regard, so that the officers can see in that regard, then that's incredibly helpful. Yeah, and a prescription is fine. A prescription is fine, on the doctor's letterhead, but letterhead's better because sometimes it's hard to read a prescription. Sometimes it's hard to read the prose if it's handwritten on a prescription versus if it's typed out or computer generated. So I think again, it's a lot of this is about common sense and practicality because you're showing it to a total stranger. So is that total stranger going to be able to understand, what your needs are and what you're, asking? Because in that situation, our frontline personnel are dealing with a lot of different requests all day long. They're not medically trained, and even if they were, they're not acting in a medical situation. They're acting as, airport security screening. Their job is to keep bombs and incendiary devices off airplanes, and box cutters and knives and everything else. So in that situation, I would just say, before you meet with your doctor again, or send your doctor's office an email, or go through the portal and have them actually do a letter, which they email as an attachment to you, and then you can print it off wherever you need it. If you need it for the DMV, if you need it for a hospital, if you need it for work or whatever else, certainly. Are there differences for rural areas more than metropolitan areas? Anthony, you're awesome. I want you on every presentation. You are just you've got questions that I've never had come to me before, but they're awesome. Not only are there differences, but please understand, because of the cultural and demographic differences of our nation, there are differences. So again, flying to San Francisco is not flying to San Diego, even if it's in the same state on the West Coast, but hundreds of miles apart. Flying to Chicago is not flying to Detroit, is not flying to El Paso. So again, there are regional cultural situations, but there are also regional biases and norms. We do a lot with training our officers on unconscious bias and implicit bias and those kinds of things. And through a lot of the trainings that I do, both online and going out to travel at the airports, I try to, have the officers help me with some of these things so that I can better help them. And I'll give you a very different example as the tribal affairs liaison for the agency. Before I flew out to Albuquerque, New Mexico 5 years ago to working in New Mexico for about a week, meeting with tribal nations and working with the airports, I was well versed on arrowheads and many other artifacts that Native Americans use and carry and whatever. What I wasn't familiar with is a buffalo lance. And a buffalo lance is about a 7 to 9 inch arrowhead that really is a weapon. So in terms of, can you take a 1 inch or 2 inch arrowhead through the checkpoint? Most likely, yes, in that situation. But can you take a buffalo lance? No. It looks like a knife, acts like a knife. Literally, somebody could stab someone with it in that regard. So it's a situation, too, that I've had to become more culturally competent. To your question, Anthony, and again, I grew up in a small town on a farm in Maine. I spent, the majority of my adult life in Boston, working for a major university before I moved here to DC 9 years ago. Boston and DC are nowhere near alike. They're completely different cities in terms of culture and expectation and whatever. And the biases I experienced in Boston with certain populations, they are that much more pronounced in DC because I'm now below the Mason-Dixon line. So in terms of, again, going all the way back, to slavery and everything else, there is so much more bias, below the Mason-Dixon line in terms of from, Maryland south, that for someone who's been a diversity professional, for many decades, it's very eye-opening when you come into these new environments. And I had to be schooled. I had to relearn, and I had to step back and listen differently to people because I'm not in Boston anymore. And let's see, I wanted to see if there was any other question or point in that situation. Okay, yes. We talked about the traveling with, with medical devices. And again, call TSA Cares. Make sure your airline also knows in that regard as well. Make sure your airline also knows, especially for things that you're bringing on board. And there was some of that in the pre-work information as well. And then I think in terms of, using the bathroom and aboard the plane, I'm also someone who has to use the bathroom, frequently. And so again, if I'm flying, even if I'm flying economy and I'm more towards the back of the plane, I will probably get asked for a seat further back in the plane to be closer to a lavatory, because like middle of the plane, it's a significant distance. And again, some airlines and some airplanes are really particular about not letting economy passengers use the lavatory in business class or first class. So even with a disability or medical condition. So I've become very strategic as I'm aging and as I need the lavatory more, to be strategic about where I sit on an airplane. The same thing when I take Amtrak. The same thing when I take Amtrak type of thing and I book my reservation. I'm very strategic, of getting into a certain car in that regard, definitely. I don't know what ship travel is, so someone's gonna have to educate me in terms of Jay's question.
Jay, I think are you related? Are you talking about like traveling on a boat, on a ship, like a cruise?
Yes, I am.
Okay,
I
sorry.
want to make a trip on on a ship,
Yep,
but as far as dialysis goes, insurance doesn't cover it, and it's $800 a time.
right,
And if you're gone for a week, that's 5 days of dialysis. That's more than anybody can really afford.
right,
So,
right.
uh,
4,000 out of pocket, exactly. I think again, what I would say is cruise line, because again, I actually just did a couple of presentations this summer with the accessibility coordinator from Carnival Cruises regarding traveling with disabilities and medical conditions. I would just say to you that specific to your situation, you may want to look at like a weekend, a 3 or 4 day cruise type of thing to minimize those expenses in that regard. Given what the prices are and whatever, because I understand, that a week or 10-day cruise would be cost prohibitive. I mean, that would certainly be cost prohibitive. I mean, $800 a day times 5 days is $4,000 net. I mean, that's a heck of a lot of money. Again, it's keeping you alive, so it's priceless in one sense. But in terms of out of pocket, if you don't have the orchard of money trees in your backyard, then I'm totally with you on that. Absolutely. Yeah, definitely. There's not really any place that a passenger can go to do homework on cultural norms, but the one thing I will recommend to you that I've learned, Anthony, is go to sites like what I did was like, visit Austin.com or visit San Francisco or visit Chicago or visit, Charleston, South Carolina or Savannah. Those websites are incredibly helpful in that regard as well. So those, because it helps you a lot about the culture and the norms and things like that. I spent the majority of my life in Boston, and my personality is very aggressive, and I'm more Bostonian than I am anything else. And my Boston personality is not welcomed in many places that are much more laid back and everything else. And so I've tried to educate myself to understand culture and norms, even culture and norms of, women shaking hands with men or, other kinds of situations. And so I've found that like the city's websites, the tourism websites have been the best place because they're being much more inclusive of all traveler populations. And they want to help us, as outsiders, as foreigners in that regard, to be able to engage and interact and as well. So I hope that's helpful as well. And so, is insulin safe in the scanner? Again, the scanners are certainly safe. for sure, in terms of things like medications and whatever, unless your doctor tells you otherwise. And in that situation, and things can be what's the word I'm looking? Things can be manually screened by the officer. So if there's something that can't go through the scanner, in that same way, then again, it's important for you to make sure that the officers know. I mean, take out that insulin or those medications or whatever that is, and put it in one of the bins. In that regard. And make sure that the officer, the screening officer and the X-ray officer knows, so that again, you want that manually screened as well. Yeah, and I think exactly, you contact the cruise company, and most cruise companies have an accessibility officer or accessibility office, because there's so many baby boomers, and there are so many travelers with disabilities. I mean, I'm on the board of directors of a couple of disability organizations, and we're actually looking at putting together cruises that will be heavily populated by individuals with disabilities. And we've had some Zoom meetings with the cruise companies, and they've been incredibly helpful, which is good. Sherry, 5 to 10 years ago, I agreed with you on the Chamber of Commerce. I think they're not in that same business now versus the tourism agencies, and only because of the fact that the tourism parts of the city are really wanting to be welcoming to so many people. It's the same way that, like, you can find kosher restaurants and halal restaurants and vegan restaurants and whatever. So again, I've found that chambers of commerce have gotten out of that business in most places, certainly. But in terms of, if you go to, a city, just like, say, Chicago tourism, or whatever, in that regard, it's helpful. Again, regarding the lithium batteries, Anthony, it's like, what is the recommendation from the manufacturer? Is the recommendation that the batteries be removed from rechargeable equipment in that regard? And again, go to TSA.gov in terms of batteries, traveling with batteries in that situation. And again, if your question's not answered, then call TSA Cares. Tell them, it's like, I went to TSA.gov, I couldn't find the answer to my question. Here's the specific. Because also, if they don't know, if they can't answer you immediately, in that regard, then they will make sure somebody gets back to you either via phone, or via email. Thank you, Chris. I hope this is helpful, information, because of the fact that this crowd is incredibly smart, knowledgeable, bringing up things and asking questions that I haven't received before. And I really appreciate it, because keeping me good on my game and making me think of things differently is going to make me a better professional, since I serve the entire nation.
And Marie, I know we're getting to the top of the hour here. One of the questions that came through was about if you had a DMV placard or an ID. Gosh, I'm trying to find the specific question. If that would be helpful for them to bring that with them.
Only if you're renting a car or going to be riding in a car, but it's not going to be helpful with TSA.
Okay.
Because again,
Perfect.
that's for a vehicle, and so our officers are going to be confused. Why
Right.
are you showing them something? Right, exactly. So again, especially given what I'm understanding are the medical and medication and medical equipment needs
Yeah.
of this, larger population, is, the doctor's note, the list of medications, whatever. So great question. And again, like, I travel with my placard because of the fact that somebody else may be driving a car at the other end. And so, right, I don't want to be parking, 6 blocks away if I can be parking closer in that regard. But again, it's a great question. But not for TSA, because they're not going to understand why you give it to them. Yeah.
Okay.
Yeah.
Perfect. So what I'll do, if you're okay with it, is as more questions come through, I'll collect them, and if I can send them to you after, and then we can kind of pick your brain for it, and I'll share your contact information.
Sure. Yeah.
Is there anything else that you would like to add before we have a few slides just to wrap up, but I want to let you wrap up as well.
No, and I just wanted to say to Delanta, it's like, I always take a window seat because I have dwarfism and my feet and legs don't touch the ground. I literally appreciate like that wall of the plane, literally in terms of like, you know, getting myself into my seat and out of my seat. So I have to have people move, you know, to go to the restroom. But an aisle seat is very uncomfortable for me because I don't have enough support for my body. And most of my pain and discomfort is orthopedic. I mean, in my back and my neck and my hips. So, I mean, I choose a window seat for similar reasons, definitely. But no, okay, I'll stop talking so you can wrap up.
No, that's okay. We appreciate you so much for being here. I know there's going to be quite a few questions that come in after, so we'll collect those and we'll make sure that we'll send them out to everybody after so you have the answers. And we'll also make sure you have access to this recording and the slides so you all can grab those specific websites and numbers. So I know we've got about 4 minutes. I apologize, a few things to wrap up. I wanted to say a big thank you for you all for engaging on Basecamp. I know when we don't have our individual group meetings, we don't engage as much. So I appreciate everyone who logs on and gives us insight, especially on those resources we're developing, but also just kind of checking in and letting us know how you're doing. We really want to know about what you're doing out in the world. So we appreciate that. If you have not been invited or are not participating in Basecamp and you have questions, just let us know. We're happy to guide you through that process. Next things for you to be aware of, our next health equity call is in November. We didn't have one this month because health equity was part of our patient summit. So for those of you who are in our health equity committee and are interested in joining, the next one will be that final Wednesday in November, November 29th. We'll be sending out reminders for that. And then our next affinity group meeting, we are going to have another group call just for the sake of the holidays. So that will be on December 14th. You should have that invite in your email box. If you do not have it, please let us know. We will send reminders. But we're going to have some great information from our CASER, our Kidney Community Emergency Response folks. They're going to be sharing some just overall emergency preparedness information, especially for those who are moving into the winter months. Here's a reminder about our Health Equity Committee. We'll be sending out lots of information as we get closer. Just a reminder about it's flu shot season. We'll have a big campaign in December for National Influenza Week, but it is the beginning of flu shot availability. So please speak with your providers and get that flu shot if it's appropriate for you. There's also some great resources on our ESRD NCC website if you would like to share them with others in your clinic. And I see some great comments coming through. Yes, absolutely. We would love to have Marie back. We will definitely be poking you, Marie. Don't you worry. We like to hang on to our special speakers. A big thank you to everyone who joined us today for our our joint group. A big thank you to Marie and your time. Such great information. I think that's going to serve us all really well. Whether we all travel individually or we have folks that travel, we can share that information with them as well. Here is our contact information. I will grab the chat with all the extra questions, but if you have any questions after the call, please email the MPFE LAN or pop something in Basecamp, and we will get those questions over to Marie. And I think that is the end of our call. Appreciate you all for being here today. Have a great rest of your week. And Marie, thank you again so much. Appreciate you.
Thank you. Thank you. What a great group. This was great. Thank you.
Thank you.
Thank you very much.
Bye, everybody.
Bye.
Thank you for your information.
Take
Thank
care.
you.
Be safe.